I am Darame Gonzalez, student nurse from Our Lady of Fatima University. So in this video, I will be doing bathing of the newborn. Bathing of the newborn is very important to every baby because they are sensitive and prone to infections. It will also help them to feel refreshed and comfortable. Good morning, ma'am. May I know your name? So your mom Natalie Cruz. So good morning, ma'am Natalie Cruz. How you're feeling? Okay, that's good. So may I check your baby's name? Okay, I will check her identification bracelet here. So she is Cassandra Cruz. Okay, she's very adorable and beautiful, ma'am, just like you. Yes, ma'am. So this procedure won't take a long time. So don't worry about it, ma'am, because it will help your baby to feel refreshed and comfortable. At the same time, it will help us to see if the baby has anything on her body. We can assess it through doing bathing of your baby. I also encourage you, Ma'am Natalie, to join with me while doing the bathing of your baby because it is very important and it will help you to have some informations while doing the bathing of your baby when you go home. Yes, Ma'am, it will really helps you a lot. So I encourage you to join with me. Okay, Ma'am. Thank you, Ma'am. Hi, Ma'am Natalie. I'm going to take your baby because I'm going to transfer her on the other bed and prepare her for the procedure. Thank you, Ma'am. Before we start, make sure to gather all the materials that you will be using in this procedure. And make sure that the materials that you will be using is clean. Because as I mentioned earlier, newborns are very prone and sensitive when it comes from the bacteria. So I will do the hand washing to avoid any contaminations of bacteria when I hold the baby. So in this procedure, I'm not going to wear gloves because it might be feel slippery when I hold the baby. So there's a possibility that the baby might fall if I used gloves. So I will use my bare hands. Take note that it is important to cut your nails short because it might scratch the baby's skin because the baby's skin is very sensitive and smooth. I am going to proceed for bathing of the newborn. So I have here two basins, a basin top and a basin bowl. So this is a regular water and this is a warm water. So I'm going to pour it in the basin top. And I'm going to put a warm water, a hot warm water. Okay, here in the basin tub, make sure that the water is not cold and it's not too hot. Make sure that it has a warm water temperature because we avoid that the baby might shiver if it's very cold, and if it's hot, we avoid that we damage her skin. So while checking this water, make sure to check the temperature of the water using your elbow. Okay? So the water is very good because it has a warm water. It is not cold and it's not too hot. So we are ready for bathing of the newborn. I will check the temperature of the baby if she is warm enough to do bathing. So baby Cassandra is ready for the bathing. So I'm going to undress her. I'm going to remove first her bonnet. I will clean the eye first. So we're going to follow the principle of cleaning, which is clean to dirty. I'm going to start from her head downward to the lower extremities. So I'm going to get 2 cotton balls. I will be using cotton balls removing eye secretions of the baby. So I'm going to dip it here in the water. So Don't use any soap on her eye because it can irritate the eye of the baby. I'm going to cleanse the baby eyes from inner to outer contours. And then I will discard this used cotton balls. And I will get the dry one to dry the eye of the baby. So I will going to proceed from inner to outer, cleaning her eye. So okay, I'm done with the eye, and I will going to proceed to the face of the baby. I have here a small towel. I'm going to dip it into the water, and I will not use any soap because it might irritate the face of the baby. So I will fold it, and I'm going to proceed here downward. On the other side, make sure to use the every other side of your towel. Don't use the side of the towel that you use on the other side. So make sure that you use different towels. So okay, I am done with this wet cloth. So I will be using a dry one to dry the face of the baby. So okay, I'm going to wipe it. On the other side, I'm going to use it. Okay, and I will fold it for the under eye of the baby. So we are done with the face of the baby. So I will going to proceed to the next procedure. Okay, I'm done undressing the baby. So I will get her using my palm. So I will gonna turn her on the side, and I'm going to get her using my palm. I will be supporting her head, and for the body is on my forearm, some like this. I'm going to wet her head with a warm water. Make sure when you pour a water on the head of the baby is you're using your thumb here and your middle finger. Make sure to follow the ear of the baby. It is to avoid entering the water on the baby's ear. So okay, I will proceed. So I have here the shampoo of the baby. So I will pour a little. Make sure to rub gently the head of the baby. So after that, I'm going to rinse it. So after rinsing the head of the baby, I will going to get a towel, a small towel to dry her head. Next is I'm going to remove her diaper and place her on the basin tub. So place her on the tub carefully. So we will follow the principle of cleaning, which is clean to dirty. So I will start cleaning her neck, armpits, groin, and the lower part is the last part that I'm going to clean. I'm going to wet the baby's body, okay, with a warm water. I am going to use the soap. I will pour it on the towel. Okay. I'm going to proceed on the neck of the baby because we follow the principle of cleaning, which is clean to dirty. So I'm going to hold her with my hand. Okay, I'm going to support her with my hand. I will proceed on her neck. Next is on her arms, on her forearms. Going down on her groin and legs. So after that, I'm going to turn the baby so that we can clean her back part. I'm going to support her with my other hand like this and this. So I'm going to proceed cleaning her back part. As you can see, I'm rubbing it with the towel. I'm cleaning it. So almost done with the procedures. I'm going to return her on her positions a while ago. So okay, I will clip her and I will going to rinse her. So okay. I'm going to get a dry cloth and I'm going to place it here. So once the baby is done, you can place the baby on the dry cloth to dry her body. Okay, I'm done. I will lift her and remove the wet towels and I will discard it. So I'm going to place the baby here. So we're done and I'm going to dress her, but before dressing her is make sure to clean the surface of her umbilical cord. So if it's present, make sure to clean the umbilical cord. So I'm going to use swab stick. I'm going to put a little amount of alcohol. Okay, I'm going to use her on this side, downward, on the other side, up to downward. So I'm going to put the diaper first on the baby. So lift her and do this. If the umbilical cord is still present, you can fold this diaper downward and lock it. So you can fold the diaper of the baby here. You will fold it downward so that the umbilical cord will expose to the air and it will help to dry faster. And I will put the baby's clothes. So this blanket is, I'm going to put the baby here. It is to help to absorb warm temperature of the baby. So we are done with this procedure, bathing of the newborn. So the baby is refreshed and feel comfortable because of her clean body. So I'm going to return her on her mother. So that's all and thank you for watching.